episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome, everybody, to another episode of our show, bringing you another really fascinating guest today who's been involved in helping create a better tomorrow on many different fronts. Today, we have the honor of being joined by Dr. Madelyn Fernstrom, who is a neuroscientist, clinician, health strategist, and NBC broadcast journalist who serves in multiple roles, including as a professor of psychiatry, epidemiology, and surgery at University of Pittsburgh School of Medicine, founding director of UPMC's Weight Management Center, director of the Community Pediatric Weight Management Program for UPMC Children's Hospital in Pittsburgh, and senior advisor, health management, UPMC Health Plan. Dr. Fernstrom has her bachelor's in biology from Boston University, her PhD in nutritional biochemistry, metabolism, and neuropharmacology from MIT. I did her postdoc at Harvard Medical School in endocrinology, metabolism, and behavior, and is also a board-certified nutrition specialist from the American College of Nutrition. She is nationally known for the creation and implementation of scalable health initiatives to help support patients, providers, payers, and employers, and her work is focused on developing various impactful programs and platforms supporting both physical and emotional needs of healthy, acutely or chronically ill, and aging populations, and importantly, as well as the people that care for them. Dr. Fernstrom has published more than 100 peer-reviewed research articles, has 3 books, including The Real You Diet, Don't Eat This If You're Taking That, and Runner's World, The Runner's Diet. And when she's not doing all of that, she is the on-air NBC News health editor, contributor to several NBC News digital platforms, and most currently was appointed Chief Clinical and Science Advisor for Philadelphia-based and headquartered Quill, the joint venture of Independence Health Group and the Comcast organization, a really neat digital health platform that is endeavoring to offer personalized and interactive health journeys to both consumers and their caregivers. A lot to talk about today, but Dr. Madelyn Fernstrom, thank you so much for taking the time to come on the show.
Well, it's my pleasure. I feel very honored to be here, and talk to you about, health and health expansion.
I'm looking forward to it. And then I would love to start off basically giving you the floor for a little bit, just to talk a little bit more about you, a little bit of the early days, where you grew up, and when you developed your interest in this fascinating sort of biologic intersection between the nervous system, the endocrine system, and now sort of the GI system. Take us into that, if you would.
That's a tall order, and it's something, I think we're all shaped by our growing up and our experiences. And I am a New York City native. I was born in New York City, and as many did in that area, moved to the suburbs and grew up there with a family that was always based on caring. I didn't come from a scientific or medical family, and my dad was in business. But the idea that to do good for others, to serve the community, he was always into volunteerism. As little kids, we would always do a lot of that. He was the president of the Lions Club, local organization where we'd collect glasses, for the blind. My older brother went to medical school. I decided for myself, I wanted to do something which even at that time, I'm thinking about this in high school and early college, something more scalable, where I would figure I could see hundreds of patients in a lifetime, but I could see thousands or millions of patients if I went the scientific route and could do some clinical work, but also, find a way to move the needle with health. So we were raised to have that idea of others. And then secondly, of going, where would I feel a good fit? And so when I look at sort of the whole body, and I give people a lot of credit going, I could study one enzyme my whole life, or I could just study the liver. I look at myself going, the brain to me is quite fascinating because sort of the mind-body connections and sort of the giant 40,000 foot view to me was interesting. And throughout my whole career, people say, as you were talking about me, I do so many different things. They're all related in the overall health empowerment of people, doing the right things for yourself, getting the help you need, and finding actionable solutions. That's me. Science is about hypotheses and proving things. I like to take that one step further and go, what are actionable steps? Where I have always talked to patients and even the public and with television is, don't tell me what to do, tell me how to do it.
And, looking at, obviously we've come a long way since let's say back in the day when it was just all about calories, now we have understanding, and you're on the cutting edge, is that between the endocrine system, the nervous system, the GI, you throw the microbiome in there, I guess. But I went to the CDC website the other day, and I know this is from 2018 data, but some of these obesity and related obesity pathologies are pretty scary. The numbers back in 2018, 42.4% of all adults and the 19.3% of children is kind of, it gets your head spinning a bit. And I'd love to sort of get your opinion and sort of future visions on where you think a lot of the translational part of this should be headed next. I mean, obviously you're at this very important intersection. Where are we going, and how can we get some of those numbers down in the United States?
It's funny, like everything in nature, it's complicated of nature and nurture. When people talk about weight, is it biology or is it behavior? And as most things, it's a little bit of both. And when you look at, over the past number of decades, around 1960 is when obesity started to go up. You go, well, what changed at that time? There was a lot of food availability. There was lots of snacking. You get all kinds of things. I mean, gas stations became, little mini marts, which everything is now. So people ate more often and they ate a lot more. It's something when you go calories in and calories out. Is that still correct? Yes, it is correct. However, there's been so much judgment of, just push yourself away from the table and run around the block. Clearly, that's not so simple. For some people, it is. But for many people, the idea of meeting you where you are, there are some metabolic predispositions to obesity. And, something when you look at this, if you have a predisposition to obesity in your family, you might not be at a body mass index that's on the thin side of a 23. You might be at 30, but you're not destined to be a BMI of 50. And a lot of people have given up. And so as the endocrine field has expanded, there's been a real polarization, kind of like in politics. It's like of saying it's all behavior, it's your problem, just have some self-control, whatever that means, or it's all your biology. And like with everything in nature, the truth is somewhat in between. To take obesity in light of all the data and say it simply has nothing to do with you is, I think, a big mistake. And I have to tell you, in my years of being an obesity clinician, giving people the freedom and honesty to say, I do eat a lot. It's a problem. I have a hard time stopping. I eat from stress. Giving people permission to go, yes, my behavior does need some work. But then there's the biological issue. And fortunately, there's now a bigger continuity of care. I mean, a few decades ago, there was only Weight Watchers, meeting in people's houses going, it's just calories in, calories out. Now we know a lot more about biology. There are some prescription medications that help some people. And one point that I get asked a lot is, well, these medicines, these prescription drugs don't work so well. Well, why is that? And one thing that I have found through the literature is maybe a lot of people don't need them because a certain percentage of people are super responders. Maybe 30% for some drugs, it can be, 50 or 60%. But if it's not a neurochemical or biological system that has to be fixed, those medications, you wouldn't expect them to work. But it's encouraging, again, showing great evidence there is a biological basis, and we can help that with medications. But again, it's not either or. It doesn't let you off the hook with lifestyle. But we live in an environment, it's very hard to say no. Food is everywhere. Supersizing is everywhere. And actually, some recent data say, well, it's all fast food or added sugars. The most recent data are looking at things that say, it's just food everywhere. People, it doesn't matter what the restaurant is, but, it's something that we are trying to ease away from the personal responsibility, not as a negative, but going, what can I do? Medicine can help and the medical community can help, but I need to do some things myself, as if when you have cancer or diabetes or any other chronic illness of which people with obesity will have, it's sort of, I have to do my part. And I think sometimes we're slipping a little bit with that. And the answer of how do we manage this, it's baby steps to meet people where they are. This sort of blanketed, we'll just eat less is not going to help anyone.
Speaking of eating less, the topic of fasting and or intermittent fasting has been kind of hot lately, sort of in the domain. And I came across an article recently which was entitled "What NBC News health editor Madelyn Fernstrom eats for lunch." And this article clearly showed that you do not fast. It is not part of your own daily program. Give us your top line, if you would, please, Madelyn, on the fasting trends.
I have to tell you, intermittent fasting, and actually I do, number one, we all fast intermittently when we go to sleep.
Sure.
So the issue with intermittent fasting, and actually it's more skewing your eating to a time period rather than, it's like when you're having breakfast. So when I wrote that article of, here's what I have for breakfast, lunch, and dinner, most often I'll start that breakfast at maybe 11 or 12 and skew lunch to 4 and dinner later. So what this basically does is it eliminates one meal. So the rigidity of going and intermittent fasting means you only eat 6 hours a day. Most people can do this comfortably when they have maybe a 10-hour period. It makes you more aware of when you're eating because you go, I have this certain time. Now, it's not going to work at all if you go, this is my get out of jail free card. I've got these times and I will just, I'll eat with abandon. But if you look at this, you will, when you have periods of not eating for 6 hours, 7 hours, your hunger and fullness signals are more defined because now we're always snacking and grazing, we've got to keep up our energy for what? We're all so sedentary, sitting at our computers. What are we fueling for? So we never quite know, are we hungry? And we act on this being a little hungry. And we start to with intermittent fasting, just meaning you're delaying your eating by going, okay, I'm a little hungry. I don't have to act on that. I can delay that by a few hours and learn what real hunger looks like. And then when you eat, and whether your interval is, 11 to 8, that's sort of what mine is, 11 to 8 or 12 to 8, or you could be a 7 to 5, whatever that is. People who go, I get up super early and I'm hungry in the morning. You get more of a sense of your body of what works for me. It's something that, you can't follow diet books that are prescriptive because at the end of the day, none of it will work. And what does the person who writes it? And this is most books, except for me, because I make people make choices. When you're going, you have to do what's good for you. It's like, well, it didn't work because you didn't follow the plan. And so you have to admit to yourself, this is hard. Losing weight is hard. If it were so easy, everybody would be thin. Nobody wants to be heavy. But again, how do you figure out for yourself what's going to work? And intermittent fasting in a modified and moderated sense, not a rigid sense like, oh, I can only eat in this 6-hour interval. If you give people wiggle room of going, why are you doing this? You want to strengthen your hunger signals. You want to strengthen your fullness signals. You want to, be mindful of what you're eating. It's an easy way to do that without having to track every calorie. And while tracking is big, people don't want to track. They want to go, okay, fine, write everything down. If you bite it, write it. Everybody in this field and not in this field knows that. But that's not going to be effective. So we have to give people some tools that are easy to follow.
Madelyn, one of the topics that is really important to you, you've written a lot about it, especially as it pertains to sort of these critical population health initiatives, is the topic of scalability. Yes. And I think we've been treated in the public to sort of some of the view of what that means. I would think in the last couple of years in terms of, say, the scalability of getting the COVID vaccine out there. On the other hand, we have, I work in the world of biotech, and we have these innovations like the gene therapies and the CAR T cells and so forth with these price tags of, $500 million, $2 million, not really scalable yet. Talk about scalability, if you would, and why it's such an important topic to you.
When we, scalability, as you accurately point out, it's very different depending upon what you're talking about. When I talk about scalability of programs, it is in response to a rapidly changing healthcare system. A few decades ago, whether it was yourself or your kids, you go to the doctor, they take care of everything, they tell you what to do, go pick up your prescription. And now it's the patient needs to be empowered. We partner with you, shared decision-making. And most consumers of healthcare don't know what any of this means. They're just going, well, what do I need? A lot of people, especially in these times, are remote. It's hard to get to doctor's appointments, even the logistics, the parking, taking your kids after school, whatever it is. So people go, maybe I won't pay so much attention to this. To me, scalable health takes advantage of the digital age which we are in now, and especially with a company like Comcast NBC, and a health partner like Independence Blue Cross, because you have health and media intersecting. So, for example, Comcast is in 50 million homes. Yep. When you look at that, how people want to digest information where they can get it easily on their phone, on a tablet, on their computer, or even, in the comfort of your own home on a television. So when you look at that, people need to be comfortable so they can listen and learn. And it has to be something that's applicable, that is engaging. And what does that even mean? I mean, the biggest problem in healthcare is we can't engage people, to do anything. So that term is what scalability has to address. So you meet people where they are in any kind of digital platform. Some people like to get an email. Some people like to get a text. And so when you learn about populations and you have health plan partners, when you have payer partners, when you have partners that go, here's what we need for our employees, we can't reach them all. Scalability means easy to understand, practical, useful information that allows people to take care of themselves and their families in a better way. It's a lofty goal. I love that you point out scalability is very different when it comes to healthcare. So it's also health equity, and the idea that it's really hard. If you've got a car and plenty of money, you can hospital side park at valet parking. But if you've got to take 2 buses and it's hard for you to get there, and maybe you don't speak English, having a digital platform that reaches you of what to do, who to call, how to have telehealth visits. These are the kinds of things that I think are the hallmarks of scalable health.
And you mentioned, I mentioned in the bio, of course, in addition to the many hats you wear, you are now Chief Clinical and Science Advisor to the Quill organization, which is this fascinating joint venture. Digital health, it's such a it's a topic that's we're seeing everywhere. I actually just did an episode a couple of weeks ago with the American Cancer Society, where they were talking about creating a specific program. In this case, how you deal not just with your chemo, but obviously the side effects, what comes after. Talk a little bit about what you are personally excited about in terms of personalized health management, about educating the public using these tools. What gets you excited in the digital health space? And talk about a little about what you're doing at Quill.
In terms of the digital health space is exciting to me because it addresses 2 things. It provides the information for patients in a usable way. And remember, we're, an NBC, Comcast NBC is a media company. Yep. And so engaging people with, snappy content and great videos helps to be more informed. And data will show that if you are more informed, you're less stressed, you know what to do, you know what to expect, and you'll be a better patient. And why would a health system or an employer care about that? Because it does save money. You're out for a shorter period of time. You're released from the hospital sooner. You're readmitted less often. So it's a win-win both financially, and the cost of healthcare can't be ignored. While we were all do-gooders and go, we just want the best for the patients. And the answer is an asterisk. Yes, we do. We want the best for the patients, and we want the most economical model we can use. And that's what digital health can do. And so when you partner with, it could be Penn, it could be a company, it could be any group that goes, I want to be able to streamline and have economy of my employees. There's limited doctors and nurses. So when you save doctors and nurses time, you're saving the hospital a lot of time. If you save them money by fewer readmissions and fewer ER visits, but importantly for the patient and their caregivers, a very big thing that Quill, which is really, it's the health arm of Comcast and the health partner with Independence, is to go, how do we make people better prepared? How do we have caregivers in the loop? Because this is not a journey someone will go on their own. And we call all of these adventures journeys. And quizzes to personalize this, of learn about yourself. Are you have special health issues? Do you live by yourself? What are the needs that you need to have met so you can be a patient that adheres to both a short-term thing like a hip replacement surgery, or long-term things like blood pressure regulation or diabetes? Because people nowadays need to take more control over their own health, like even when to call the doctor. So sometimes a lot of information is pitched really high. And what my passion is to go, let's bring this down so people know what to do at the right time through a digital front door, regardless of your technical skills. I mean, me personally, everybody who's very adept at this will be great. But one of my personal goals and what Quill works really hard at is to go, we want this to meet people where they are. So if you don't have a great education level and not much skill, there's still a program for you and a way to connect so you can take better care of your health. People would like to do this. It's interesting surveys about, do you feel confident about your ability to help yourself? No one asks that. People get marching orders. But when someone says, do you feel you know what to do? Do you know who to call? There is an empathetic tone that is so important in healthcare that has really disappeared, because less and less do we have this one-on-one with the doctor or the nurse or the care team. And so a large part of what Quill is doing and what my passion is to go, yeah, we can put the empathy into digital healthcare. It's not cold and tech. Yep. It's really personalized.
Once again, focusing on sort of two areas that are important to you, some impactful programs, but also scalable. One of the targets that you're very interested in and passionate about is aging. Yes. And healthy aging, longevity has really been a key theme across many of our episodes. Yes. We have, I did this AARP episode a couple of weeks ago, 127 million Americans now over the age of 60. And we see really two themes. One, this topic of aging in place, that we want to make our home not just a smart home, but a smart, healthy home. And then another subset of these episodes is on innovation that can help a health span, how we can sort of shrink morbidity later in life. So it's not this, all-encompassing period of decades as we get older. Talk about what gets you excited specifically in healthy aging space and some of the trends you're seeing.
Healthy aging, number one, is now I'm happy to see the pendulum is sweeping a little back to embracing aging. 60 is not the new 40. It's 60 is 60, and you want to be the healthiest you can be at every age. The best news is, lifelong, good health is its own reward. And if you have lifelong healthy habits, which are hard to sustain, eating, getting enough sleep, activity, all of this stress management, but it's never too late. And so when we look at aging in place, what that means for most people is I want to be in my home as long as I can. I don't want to live with my kids. I don't want to go to an assisted living facility. And sometimes the kids will go, what's the problem? It's like a hotel, you're like on vacation. But that sense of independence and changing times, and that can happen anywhere between 60 and 90. It's something, it's very variable, but keeping the best health you can. And how to do that. What are proactive things you can do? What if you've got chronic illnesses? But the idea of, what can digital health do? What can help in the home do? And Comcast is very big on this. And, many people don't know Comcast has a set of labs that probably a decade before things come out, they're being experimented with. So when you look at this, if you're in your home, how do you get reminders to take your medicine? Like, for example, you might have a visiting nurse come in, and put out all your pills, but who's telling you to take them? So it's having technology for reminders to help a caregiver, whether it's a child or a partner or someone who has lived there, to know, did mom take a walk? Did they get up today? These kinds of things, technology is going to be a huge supporter of monitoring people at home. So caregivers don't have to be living down the block, because our world is so big now. It's different, the generations, the last two generations, people don't live in the same areas or the same city. So perfect world, yes, you'd live down the street from someone, you could help them. And then, but for yourself, going, what do I want to do? There was a great fear of the unknown. What if my health, goes south? What if I can't take care of myself? But the goal, which is more optimistic, and with all the digital tools in place, Comcast, other companies have them too. So you can self-monitor, have monitoring services that help you. So you have the kind of independence you need. Where the sweet spot, of which I think there are some solutions that we are working on at Quill, is to go in that transition when you start to need some help. So it's not, you don't go from one day, I'm perfectly fine to, wow, now I need a lot of help. And that transition using technology will be very helpful. So it's much more about your confidence in your ability to do things rather than how much can you actually do. So it's more like, it's not what you lost, which you will have declines as you age. It's what you've got left and how good technology can help you. And there's a fine line, like what's too much versus, a little bit, because many people are overwhelmed. But when you have that, if the population over 60, some people are good, but people can learn. And technology is getting easier and easier. Now it's press a button. Here's the very few logins, and it becomes, again, that issue of, I get back to this, meeting people where they are, having people do the right thing because it's easy for them.
And you, thank you for that. And as you were just mentioning, you put the caregiver in that equation, which is also an extremely important item for you. Anyway, I think the one area that sort of stands out as I sort of read the literature and so forth is what's coming in the next couple of decades in regard to dementia and this wave of Alzheimer's,
right.
And specifically the caregiver there, because this is I saw my father die of cancer, and we have no Alzheimer's in my family, but from people that have dealt with that, it is a different feeling. It is a different set of caregiving,
yes.
Let's put it that way. And
yes.
you have more experiences. Talk a little, say a few words, if you would, about the caregiver and some other, how these initiatives, specifically in the area of dementia, can really help support not just the activity of the caregiver, but the mental and physical well-being of the caregiver.
Yes, this is actually one of my biggest passion projects and what I spend a lot of time on, and what Comcast and Quill has been really focusing on in terms of caregiving, because it's not just for yourself or for others, but there's a need for this. Brain health is very big. People maybe 40 years ago didn't worry about your brain. You're worried about your heart or diabetes, but brain health and having, complete cognition is really huge. The incidence of Alzheimer's, it's going up, but why? It's more probably better diagnosis. Years and years ago, people said, oh, you're, a little off, you had hardening of the arteries or something else, but every kind of dementia and the aging brain is not Alzheimer's, because that's a big challenge. It's not just you're losing your memory. There are violent outbursts, there's other behavior changes. So when people are going into that deep abyss, it's frightening for the person and the caregiver. And when you look at that, there needs to be a structure, an algorithm, if you like, in place to going, when you start to notice changes, because this is the continuity of care. You don't flip the switch one day and someone's got, oh my God, they've got Alzheimer's. You notice things and then you keep track of that. And whether it's yourself or someone else, when you're caring for someone else, you need to get the right help at the right time. It is medical, emotional, and for the caregiver themselves. One of the biggest problems in healthcare now is caregiver burnout. And we need to provide better tools for the caregiver. And it's not, oh, join our online support group. It means tangible things like getting prescriptions. How do you find extra help? How do you find extra help if you don't have insurance? How do you enlist the right family member or friend to make sure the quality of life is optimal for the loved one, and you still have a life? So caregiver burnout, when there is so much in dementia, and as you point out, it's very, very different to have memory loss issues versus heart issues or diabetes or things like that, because it's very frightening. Those things are pretty silent, but when you see behavior change, as you see in Alzheimer's, it's heartbreaking, not just to watch this, but the person going through this is quite aware until a certain point. And some people I've worked with have said, I almost wish they would click along. They don't know this is happening anymore. It's quite painful to watch, and the patient is going, this is getting bad. And it is heartbreaking for both people, but an open discussion and understanding, how do you deal with this? How do you talk about this with the patient? You can't say, oh, no, we all forget our keys. You can't kind of push this all out of the way, and having some action plans of how do you discuss this? What are steps for caregiving? How do you have everybody's emotional health maintained? Because compromises in brain function, are very tough.
Yep. Madelyn, as you know, I read your bio at the beginning. You're a neuroscientist, clinician, health strategist. You've been walking us through these amazing programs, but you were also a major media personality that went to MIT and Harvard and knows a lot about health. Talk a little bit, first of all, in general, how you balance these two roles, which are extensive. But at the same time, as you know, we now have major media personalities out there that are not Harvard, MIT trained neuroscientists and clinicians giving advice to the world. Talk a little bit about what you see in sort of this evolving media space in terms of where we are in 2022, where we should be going, and how we can, I don't know, get the right the right people back about talking about these issues to the masses.
One thing that has changed, I love this question, Ira, because it's really important. How do you know what good information is? You can have, highly trained people, you can have crackpots, and, if it's on the internet, it must be true, which is probably the worst thing about getting information easily. And everyone has an opinion. So the idea, my personal quest, and I write about this and talk about this, is how do you identify good information? How can you sniff around a little bit and go, this doesn't sound right? One rule of thumb is if it sounds too good to be true, it probably is. There's been a lot of high profile people who have disastrous information, but the thing that is going to change this and where the needle is moving is that academic and clinical people who are not media people are becoming more active in wanting to discuss things and have a retort to these things, because they're no longer like shot down by the the minions of the media people going, oh, they don't know anything, because there's nothing in it for valid people, in general, who just go, I'm a Princeton professor and I work in food intake, and having a commentary like that to neutralize certain things, is really important. So I think the general academic and clinical community is coming out. And I think the valid people who've always been there, but sometimes are overshadowed by, the squeaky wheel that has some unfounded things that just sound really good and are great sound bites, are stronger, and actually naming by name people and the information that this is wrong. Mm-hmm. And I think this is a gradual movement, which I'm happy to see, but I think academic and clinical people, of which I encourage everyone to go speak up. Someone calls you for an interview, don't be too busy. Don't say, oh gosh, Dr. X is the crackpot. I'm not even going to dignify that with a response. And my suggestion is, no, talk to them and they will put you in your point of view. And I think more people are doing this because the misinformation about basic things, eating, weight loss, managing stress, there's so much out there and people don't know where to look. So again, it's just like regular healthcare. Educating yourself to how do you find information is big. But I think the pushback and now the follow-up from clinicians that are willing to be out there a little, and the medical Twitter sphere, medical Twitter, you can go #MedTwitter. You see a lot of people, you've never heard of them, one or two maybe, interviewed on the news, but they're doctors and scientists and people that are giving good information, and they're, doing a lot of myth busting and naming names, going, this is such bunk, forget it. So that's another resource that people, you don't have to be, medically savvy. You can just be interested in health. And the medical Twitter is a good place to look also.
Excellent. Madelyn, while I have you, anything hot coming up in 2022, future initiatives, things that we should know about, where to be watching you or seeing you give talks, and any other things you want to highlight while we have you now?
I think what we can look at, what are the trends in 2022 is more will be in the home, whether you're caring for someone else or that you're caring for yourself and you want to, as you said, the aging process, but having more tools come to people to make healthcare easier. And there are point solutions, meaning there are companies that go, I will help you with diabetes, like Livongo. So if you have diabetes, this is through a health plan or from a company. This is the company, for example. I have nothing to do with them. They're just one-stop shopping. For example, you have diabetes, they give you a unit, everything is tracked there. They'll send you the pinchers, they'll send you a strip. If your sugar is high or low, they have someone call you. So there are many point solutions, whether it's pregnancy or preparing for, an orthopedic surgery. That's going to happen more and more. Where I think the bigger challenge is, and what Comcast, NBC, and independents are doing through Quill, is to go, we want to be the 40,000 foot view. We want to prepare everyone. We want to meet people where they are. We want to take fundamental concepts and apply them across every health issue, and really empower people across the health divides for health equity. The health equity issue, I think, is going to be big in 2022 because, we're dealing with things up here, but let's reach the people that really need help and fewer resources.
Wonderful, really wonderful. It's a fascinating journey, Madelyn, that you've been on. I really appreciate you sharing it with us. Wishing you the best in 2022, moving all these programs forward. For everybody that's going to be listening to this episode on our podcast or watching on the YouTube channel, you've been spending time with Dr. Madelyn Fernstrom, neuroscientist, clinician, health strategist, NBC broadcast journalist. Check out the Quill organization, located here in the city of brotherly love, Philadelphia. Also check out her books, The Real You Diet, Don't Eat This If You're Taking That, and the Runner's World Runner's Diet. Madelyn, I want to thank you again for taking the time out of your schedule to do this. Thanks for everything you're doing there. And as we like to say on this show, thanks for helping to create a better tomorrow for all of us through your work.
Well, thank you, Ira. It's really been a pleasure and an honor for me. And thank you for being a partner to move good health forward. I appreciate your efforts too. Really been nice. Thanks again.